For the audience, too, if you can help us a little bit, they might be interested in what are the criteria that you would use to decide if somebody needs hospice care?
Sure. Well, the Medicare, general guidelines, which is basically what everybody kind of goes by in terms of thinking about hospice eligibility criteria, is that the person has to have a prognosis of 6 months or less as determined by their physician, and that they are no longer seeking what is called curative treatment. That doesn't mean that that's stopping all interventions, which I think is what some people kind of think about hospice is like, that's it, there's no interventions, there's nothing else done. It just means that the focus of the intervention is comfort and symptom management. Hospice is really more about living than it is about dying. It's about helping people's quality of life as opposed to quantity of life. While it doesn't hasten the course of anybody's life, it does allow them to live as comfortably and as fully as possible. So that's a little bit about the criteria. When hospice was first coming into effect, people really thought it was only for people with a cancer diagnosis.
Yes.
And now more and more,
it's much more.
It's such a variety of patients. It could be people with end-stage, renal disease, kidney disease, lung disease, congestive heart failure.
Yes.
People with advanced Alzheimer's and dementia, and also there's just for frail old people who really there's no technical diagnosis or ailment for them, but their bodies are older and they're getting more frail and they need hospice care too. So
sure. Wonder if you could if you can all comment some on the staff too, and some of the kinds of things that the staff team does too. A little bit about the staff and a little bit the numbers and stuff, and some of the kinds of things they're involved in.
Our staff is comprised of mostly master levels clinicians. We have registered nurses, we have a medical director, we have social workers, we have the office staff, and of course volunteers that make up a large part of our staff. And it's a team that helps every client and their family.
And there's a wide variety of services that they give. Yeah.
Yeah, we also offer home health aid services. We have a spiritual care coordinator who's very involved in the care of our clients as well, and volunteers certainly are. But it's important to know that it is such a multidisciplinary team that is able to provide that care and help. We really see a unit of care. It's not just the person who is sick and who is dying, but it's the family members, it's the caregivers, it's the neighbors sometimes, it's everybody. And so we really are able to provide all of those different types of services, which is an advantage of using hospice care.
That's the exciting part of this program, which I'm going to ask a little more about too, just the depth and the variety of services. Before that, I just wanted to ask just a factual question about how about funding? People who are watching this may wonder, how does this get paid for? How does it work?
Insurance reimbursement. In Massachusetts, it's a mandate that all insurance companies do offer hospice coverage. We're a lucky state to be living in.
It's not true in all the states?
It's not true in all states, and I wouldn't necessarily know exactly which states, but it is. It's a Medicare entitled benefit, and so it is reimbursable through Medicare. Other insurance companies kind of took the lead from Medicare. So Medicare, Medicaid, Blue Cross Blue Shield, and most other private insurance companies do now have some kind of a hospice program or plan where they'd be able to reimburse. The way that it works is that the insurance company pays a flat daily rate to the hospice, and that daily rate is used to cover the multitude of services that we're providing.
I see.
So in some cases, when insurance coverage does not cover all of the services, we at Hospice of the Good Shepherd do commit ourselves to fundraising the difference, and we do several different fundraising activities throughout the year. We have an annual giving campaign. We recently, in September, held our walk.
Oh, this is a picture right there.
We have a picture on the screen, we hold that event annually in September. It's a 10K walk in Newton, and it's a real community event. When a lot of hospice is focused around, caring for people, that's a really nice day where we come together with families and volunteers and past family members who walk in honor and memory of their loved ones.
Wonderful.
And we generally raise this year. We set a goal, and we were able to almost reach that. We raised nearly $40,000, which was much more than in any other year. So we were really happy. So
glad to
you
hear
can always look for that event in September.
It was nice to see the picture of that too, just to see how the people are all
and it
behind
is
this cause.
Important to also know that we do have